Good morning, Tooth of the Matter here with Haley. Who wants to show off their smile with one missing tooth or up to six missing teeth? Whether it's your lifestyle or an inherited trait, you are not alone. It's estimated that 178 million Americans are missing at least one tooth. While missing teeth can destroy someone's self-consciousness to smile ever again, it can also destroy the overall health of someone's mouth. There are many reasons for this interest. Let's take a look at the cost-effectiveness treatment options to benefit a patient with hypodontia. Hypodontia is a very widespread teeth malformation in humans present from birth. It is described as the absence of 1 to 6 teeth missing, whether it's your primary baby teeth or your secondary adult teeth. The cause of this can be either from environmental changes, whether it's a trauma that happens in your life, whether it's toxins that you once took in, any of those environmental things that can happen in your life, or it can also be an inherited trait, whether it's cleft palate, any of those teeth inherited traits. What really drew my interest was whenever I decided to watch my best friend's little girl, Emma. She was eating a little snack or something or smiling really big. I was like, hey, smile real big one time. Down here on her lower, you can tell that one tooth is a lot larger than the other tooth. And I was like, okay, that's a little strange. So took this little snap. I sent it to her mom. I did get the okay for this x-ray to be up. She goes, you are not the first person to notice that. And I was like, oh, really? She was like, yeah, well, we're going to be taking a trip to the dental office pretty soon. So they got this x-ray, and sure enough, that tooth is bigger because she was missing one of her interior lower teeth. So that tooth decided to kind of grow over a little bit into that spot, and now it's a bigger tooth than what is normally there. So the different treatment options for this could be braces. One is to pull them all together to make them functionally work together. Well, that is a great option, but with that is different other restorations can take place as well. While pulling all those teeth together, like you could do on little Emma girl, you're going to have one tooth that is a little bit larger in that spot that doesn't really look aesthetically pleasing. So in that case, you could either do the opposing or adjacent tooth next to it that is supposed to look identical to it so you can have a symmetrical smile, is to add a little bit to it, take a little bit off, which is called bonding. That's one restoration. You can do veneers, you can do crowns. There is different other restorations as well that you can do with the braces treatment option. Invisalign is another orthodontic option, but with the space closing with orthodontics, it's not as easy as the braces. So I know a lot of orthodontics, they usually like to recommend the braces over Invisalign. Your next option can be a removable partial. With this, some people like it, some people don't. Some people are not into pulling something in and out of their mouth, but it does work. So this is another option. Another option is also a bridge. It can be placed back on your molar teeth, kind of like on the very top here that you can see. The thing about this is you sometimes are not necessarily destroying, but affecting teeth they call virgin teeth that may never have had a crown on it, never have had a cavity to where you needed a filling. It was just a perfectly fine tooth. So that does come along with bridge. But as you can see on the lower, this guy was missing the his two laterals right next to his big upper teeth. And they decided to go with the bridge, and you can see that the bridge is very aesthetically pleasing. For the most part, I have always known that the bridge is also very functional, and it works great with your bite and feels very comfortable as well. The cleaning takes a little bit more time as you have to pull a floss thread or use a little water pick back there to get underneath that pontic of your bridge, but other than that, it is also another great option. Another option that I'm going to talk about, this is finally the last option, is your implant. This one is great. It acts as a one solo tooth. You can also do an implant bridge if needed, if you had more than Like I said, hypodontia is 1 to 6 teeth missing. So if you had 5 teeth and you wanted to do a 5-unit bridge, you can do that with implants as well. The implant serves as a whole tooth from the root to the crown. It is a little bit longer procedure. It is surgically as well. You surgically place the implant into the bone. You have to let the implant heal for up to 3 to 4 months. You also have to be very healthy for this procedure as well. If you've had different procedures done in the past, you just have to get a doctor's note, and usually everything goes very well. I have never seen anything go too terribly bad with the implant. I've seen one patient not be able to take the implant because her body did not accept nickel titanium, but there are different implants that different doctors use, so that is an option. So after that, then you can see that down here lower, that after the implant surgery, you will wait 3 to 4 months, and then you can come back, and as long as your bone had taken the implant, then you can go ahead and proceed with the impression, and after that you will get your crowns from 2 to 4 weeks later, and you'll have a very aesthetically pleasing smile after that. Last but not least, what comes with every dental patient is the burden. The cost burden. The lowest would be obviously the removable partial, but then again, some people don't like that. Some people think it's yuck, like, ugh, if I'm gonna have to eat out of the restaurant and remove my teeth, it's kind of not so, ugh. I don't know, it's not too bad though. But the tricky thing with that is it can add up over time. You can lose them, your dogs can eat them, whatever is your chew toy, your doggies love that. But then again, it is an option depending on your case and your situation. The next one would be the bridge. Like I said, that is a good option. It is pretty durable. Depending, you can still get cavities underneath the crowns that have to go onto those 2 teeth. But other than that, it is a good option. That option ranges anywhere from about $500 to $1,500 depending on your dentist, depending on your situation, of course. And the partial denture, I apologize, values anywhere from $1,000 to $2,500. The next option would be the implant, and that is anywhere from $1,500 to $6,000. That is the most durable. It is surgery though. The next option was the orthodontics with the braces. That is actually the most expensive one. It is from $3,000 to $10,000, and sometimes it doesn't always work either, and you do always have to wear retainers at the end for the rest of your life, or your teeth will go back to where they were from the beginning. But do not worry, no matter what it is, there is always a way to benefit your smile and keep smiling for the rest of your life. Thank you.